ఓం ఠం ధన్వంతరే నమః రాగాదిరోగాన్ సతతాన్ శక్తాన్ అశేషకాయాన్ ప్రసతాన శేషాన్ ఔత్సుక్యమోహానతిదాన్ జఘాన యోగపూర్వ వైద్యాయ నమోస్తు తస్మై. Topic is bone marrow study. Bone marrow aspiration and biopsies are often performed both in the inpatient and outpatient settings for the diagnosis of a multiple of hemorrhagic hematologic disorders. Both the palpation guided and computed tomography guided approaches are common methods for performing this procedure and have high diagnostic accuracy as well as low complication rates. Its activity outlines the proper procedural steps in performing a bone marrow aspiration and biopsy and highlights the role of interprofessional team in managing patients who undergo this procedure. Introduction. Bone marrow aspiration and biopsies are often performed both in the inpatient and outpatient settings for the diagnosis of a multitude of hematologic disorders. Both the palpation guided and computed tomography guided (CT guided) approaches are commonly utilized for performing this procedure. Both procedural methods have a high degree of accuracy and a low complication rate. The proper procedural steps in performing a bone marrow aspiration and biopsy will be explained as well as the roles of the interprofessional care team in the managing patients who undergo this procedure. The steps involved in performing a bone marrow aspiration and biopsy, as well as the required personnel and material, should be thoroughly understood prior to performing the procedure in order to avoid inadequate sampling or adverse patient outcomes. Additionally, the healthcare professionals better understanding the indications, perioperative management, and complications of this procedure can improve both patient experience and better diagnostic accuracy. Indications of bone marrow study. Indications for a bone marrow aspiration and biopsy include, but are not limited to, definitive diagnosis of hematologic disorders such as leukemia, multiple myeloma, lymphoma, unexplained anemia, and myelodysplastic syndrome. Other indications include aneuploidy in neonates and fever of unknown origin. This procedure can even aid the diagnosis of atypical fungal parasitic disorders such as histoplasmosis, leishmaniasis, cryptococcus, and Q fever. Many of these conditions require both aspiration and biopsy for a complete hematologic workup, diagnosis, and treatment planning. Contraindications for bone marrow aspiration. Absolute contraindications to bone marrow biopsy and aspiration include severe bleeding diathesis, such as severe hemophilia or severe disseminated intravascular coagulopathy. Thrombocytopenia is not a contraindication, and platelet transfusion can be performed if clinically warranted prior to the procedure, commonly performed if platelet counts are below 20,000 cells per microliter. Aspiration of the sternum should only be attempted in patients over the age of 12 years, not below 12 years. Patients with diffuse bony resorption due to metabolic or lytic processes, such as that in patients with multiple myeloma, should be aspirated at the iliac crest and not the sternum due to the risk for performing the sternum and subsequently the mediastinum. Biopsy of the sternum is always contraindicated due to the same risk even in patients with healthy bone. Equipments. A computed tomography scanner may be utilized if indicated. This is often the case when an interventional radiologist performs the procedure. A bone marrow kit should be utilized containing sterile drapes, needles, syringes, an aspiration needle, a biopsy needle. If performed in the posterior iliac crest, a Gemshidi needle is often preferred for biopsy. 1 to 2% lidocaine with or without epinephrine, and specimen slides and specimen containers will be required as well. The number of required pathology slides and specimen containers will vary depending on the type of pathology under investigation and whether or not a biopsy will be performed in addition to the aspiration. Clinical significance of bone marrow aspiration. Bone marrow aspirations and biopsies remain a mainstay for the workup of hematologic malignancies and their definitive diagnosis. These methods avoid more invasive procedures, can yield an accurate diagnosis in a relatively short amount of time, and are relatively uncomplicated to perform. The quick nature of the procedure, the potential for avoidance of sedation or general anesthesia, and the ability to perform the procedure on an outpatient basis facilitate an efficient path towards diagnosis and treatment, as well as a non traumatic experience for the patient. Some of the pictures related to bone marrow study. You see the bone marrow, which is aspirated under microscope. The needle, this is under microscope, just same. This is the blood picture, yes. Paper spear. Healthy bone marrow and multiple myeloma. Can see image cells. So multiple myeloma. The healthy bone marrow and the plasma cell myeloma. Stem cell transplant. Can see the immature cells. Leukemia serotypes. Depending upon the histological study, we can classify or we can diagnose, differentially diagnose the case of leukemia. The paper smear, metallurgic studies. Where to compare the finding of bone marrow biopsy and paper smear. Complete hemogram also we can do so that we can have it. differential diagnosis along with bone marrow biopsy. Also slides related to so these are the advances. So today we have discussed about bone marrow aspiration and biopsy. Thank you for patient hearing.